Thank you for joining us for the training on immigration and public charge rule, brought to you by the Wisconsin Collaboration on Immigrants and Public Benefits. The presenters today are Stephanie Sievers from Covering Wisconsin,
Megan Sprecher from End Domestic Abuse Wisconsin,
William Park Sutherland from Kids Forward.
The Wisconsin Collaboration on Immigrants and Public Benefits came together in February of 2019 to discuss the troubling rising level of fear among their immigrant clientele. Our stakeholder group consists of legal experts from Legal Action Wisconsin and Domestic Abuse Wisconsin, policy analysts from Kids Forward, community healthcare providers and educators from 16th Street Community Health Center and the Wisconsin Primary Healthcare Association, and healthcare communication professionals from Covering Wisconsin. Our guiding principles are: 1, that we understand and respect the fear, confusion, and stress immigrants may experience in this challenging climate. 2, circumstances change, sometimes quickly. 3, our aim is to empower individuals to make an informed decision about using public benefits. In today's training, we have 4 key messages that we hope everyone can walk away remembering and thinking about. 1, most immigrants and mixed status families can safely use public benefits. 2, public benefits used by family members will not count against the person. Only use of specific public benefit programs can have a negative impact on a person's status. And lastly, use of public benefits does not automatically make a person a public charge.
What is a public charge? Public charge is someone that the federal government believes is likely to become dependent on the government. The government does a public charge test when an immigrant is applying to change or renew their status or apply for a new type of immigration status. The impact of the public charge rule is that when someone is determined a public charge, it impacts their ability to get a visa to enter the United States. That includes getting permanent residency or a green card. It can impact someone's ability to change or renew status. That does not apply to green card holders who are applying for U.S. citizenship. These changes to public charge went into effect on February 24th of 2020. As we said earlier in the presentation, most immigrants can safely use public benefits even under the new public charge rule. Anyone with a status listed on this list is able to safely use public benefits under the new public charge rule. U.S. citizens or people applying to become U.S. citizens, green card holders, unless they travel outside of the United States for 180 days or more and try to re-enter, refugees or asylees, special immigrant juveniles, people with U or T visas, which are visas for victims of domestic abuse, human trafficking, and other serious crimes, Violence Against Women Act approved self-petitioners, immigrants with a status from the relief under the Cuban Adjustment Act, the Nicaraguan and Central American Relief Act, or the Haitian Refugee Immigration Fairness Act, Afghan and Iraqi employees of the U.S. Armed Forces who were granted special immigrant visas, and members and families of the U.S. Armed Forces, Ready Reserves, or military serving in an active duty status. Mixed status families are families where different family members have different status. So one example would be parent is undocumented and child is a U.S. citizen. We want to make it clear that for families like this and for any families under the new public charge rule, immigration only looks at the benefits that the actual individual or the person applying for immigration status uses, not what their children or other family members use. So for a mixed status family where a parent is undocumented and applying for a green card, their U.S. citizen child or family members with any types of status usage of public benefits will not impact that green card applicant.
So as we said earlier in the presentation, the U.S. immigration officials only look at a particular list of benefits when they're considering a determination for public charge. Immigration officials only look at Medicaid, or known as BadgerCare in Wisconsin, for adults over the age of 21, with the exception of emergency services provided by Medicaid for both adults and kids, and BadgerCare Prenatal for people who are pregnant. And then also BadgerCare Prenatal extends to people 60 days after the birth of their child. Immigration officials also look at housing assistance from public housing or Section 8. They will look at food assistance from Food Share, which is also known in Wisconsin as either your Quest card or EBT. They will look at cash assistance from Wisconsin Works or W-2, or supplemental security income, known as SSI. Immigration officials will also look at assisted living, nursing home, or home care as long as it is paid by Medicaid or by a Medicaid long-term care program, such as Family Care or IRIS. But again, to underscore, the use of public benefit programs that are not on this list won't be considered by immigration officials. So many benefit programs in Wisconsin are safe from the public charge rule. As we said in the previous slide, emergency services for both adults and kids are not considered. BadgerCare Prenatal for pregnant people, BadgerCare for children under the age of 21, which includes adults who are 18, 19, or 20. Marketplace financial assistance, so that is from the Affordable Care Act or Obamacare tax credits, the Ryan White HIV assistance, school-based nutrition services like school breakfast and free and reduced school lunch, financial assistance from educational institutions or student loans, financial assistance from community health centers or hospital programs, the Women, Infants, and Children program, child care assistance such as Wisconsin Shares, and Head Start. There are many other programs that are also safe. This is just a list of some of the more popular programs that are not considered in the public charge rule. So people applying to change or adjust their status can safely use these benefit programs. Immigration officials look at a variety of factors beyond your use of public benefits. And as we stated previously in this training, the use of public benefits doesn't automatically make a person a public charge. When determining whether or not somebody is likely to become a public charge, immigration officials will look at factors including work, skills, and education, income, assets, and resources, age, health, family size, and your affidavit of support.
When should you refer someone to legal assistance? A lot of people eligible for benefits are not directly impacted by this new rule, but if a person is unsure or wants a second opinion, an attorney can help them understand how the public charge rule might affect their family. Might also be able to help someone discover a way in which they can gain immigration status. Our group has put together a list of free and low-cost legal options for people who can help them determine if they're subject to public charge or if they're eligible for an immigration status. These are all attorneys and nonprofits that are well-versed in working with low-income and middle-income people. The list can be found at the website www.coveringwi.org/immigration.
Okay, so let's review two family stories. So the first family story is Anna, and she has a U visa. Her U.S. citizen child Manuel is eligible for BadgerCare Plus, which is Medicaid in the state of Wisconsin. Can Manuel enroll in BadgerCare Plus without compromising Anna's ability to get a green card?
And we know that the U visa is on our list of people who are safe from public charge. They're not subject to public charge, and they can use any benefits, and it will not impact their status. We also know that under the new public charge rule, immigration does not consider family members' use of public benefits. So Anna can use public benefits and it will not impact her ability to get her green card. And Manuel can use public benefits and it will not impact Anna's ability to get a green card.
Okay, in our second family story, we have Fatima, and she's pregnant and eligible for WIC. She's undocumented. If Fatima enrolls in WIC, will this hurt her chances of getting a green card in the future?
And we know from looking at that list of named benefits that immigration will consider when they're determining if someone is likely to become a public charge, that WIC is not one of the benefits listed. So immigration will not consider Fatima's use of WIC when they're determining if she's eligible for a green card.
So let's review the 4 key messages that we mentioned at the beginning of the training. Most immigrant and mixed status families can safely use public benefits. Public benefits used by family members will not count against the person. Only use of specific public benefit programs can have a negative impact on a person's status, and only when they are applying to change or renew a status. Use of public benefits does not automatically make a person a public charge. For additional materials, and if you have any questions, feel free to go to our website, www.coveringwi.org/immigration. There you can find resources and materials in English and Spanish, and we do have a link for another website that has resources in other languages. You can find a list of free and low-cost legal help in Wisconsin. And if you do have questions, feel free to click the Contact Us link on the website, type a short message, and we'll get back to you shortly. Thank you.